Hey, I'm Dr. Michael Kent. And look, if you're over 70 or you're taking care of someone who is, what we're about to talk about, well, it could genuinely save a life. We're going to take a hard look at a medical belief we've all held for years, one that might be putting millions of seniors at risk. Because what we've always been told is perfect might actually be the problem.
Yeah, you heard that right. For decades, we doctors have hammered it home. 120/80 is the gold standard. But you know what? A flood of new evidence is showing that for older adults, chasing that number can lead to some truly devastating consequences. It's a truth that, frankly, a lot of my colleagues haven't quite caught up with yet, but it's one you absolutely need to hear today.
Let me paint you a picture, because this happens every single day. A 78-year-old comes into the office and their blood pressure is a perfect 122/76. The doctor is thrilled, gives them a pat on the back. It's a success, right? It's on the chart. But that same night, they get up to use the restroom, their pressure suddenly tanks, they get dizzy for just a second, and they fall. And just like that, we're not talking about numbers anymore. We're talking about a fractured hip, we're talking about surgery, and for many, a permanent loss of independence. This right here, this is the dangerous gap between the old guidelines and the new reality.
So let's just tear this myth apart, shall we? It's really simple. What works for a 45-year-old just does not work for an 80-year-old. It can't. Our bodies change, and our medical advice has to change right along with them. Understanding why is the first step to protecting yourself or the people you love. So, why is that? The answer is that your body isn't just an older version of your younger self. It's operating under a completely different set of rules. As we age, our entire cardiovascular system gets a major software update, and if we keep using the old manual, we're gonna run into trouble. Okay, so there are three big physiological changes that happen as we get older. Each one of these helps explain why a lower blood pressure isn't just unnecessary for seniors, but can actually be harmful. Let's break them down one by one. First up, your arteries get stiffer. You know, think of a brand new, flexible garden hose compared to one that's been sitting out in the sun for 20 years. It's old, it's brittle. To get enough water to the end of that stiff hose, you gotta crank up the pressure at the spigot. It's the exact same with your body. To push blood all the way up to your brain against gravity, your heart needs a little more oomph. If we aggressively lower that pressure with medication, we can literally starve the brain of the blood and oxygen it desperately needs. Second, your body's built-in pressure sensors, they're called baroreceptors, they just get sluggish. In a younger person, you stand up and bang, they react instantly to keep you from getting dizzy. But in seniors, that response is delayed. So if your baseline pressure is already being pushed way down by medication, these slow sensors just can't compensate in time, and that leads to that sharp, dangerous drop that causes a fall. And third, your body just processes medication differently. Your kidneys and your liver, they aren't as efficient as they used to be, so a standard dose of blood pressure medicine can have a much, much stronger and longer-lasting effect. What's a totally normal dose for a 50-year-old can essentially become an overdose for an 80-year-old, pushing their pressure into that dangerous low zone for hours on end. Now, this isn't just my opinion or some new theory. This is backed by hard data. A massive, really important study was recently published in the Journal of the American Medical Association. Honestly, this should have been on the front page of every newspaper, but it kind of flew under the radar, so let's look at what they actually found. The results were, well, they were staggering. This study looked at over 15,000 seniors, and it found that the folks who achieved that perfect systolic blood pressure below 120, they had a 28% higher risk of a serious fall, the kind that lands you in the hospital. Let that sink in for a second. We're not talking about a little stumble. We are talking about life-changing events. And this chart right here, this illustrates the most crucial finding of all. They looked at who was living the longest. And guess what? It wasn't the group with blood pressure below 120. The lowest death rate, the absolute sweet spot, was found in the group with a systolic pressure between 130 and 140. This is the proof. Both very low and very high pressures are risky. But for seniors, that moderate range was literally the safest place to be. And falls weren't the only problem. Not by a long shot. Seniors with pressure below 120 also had a 14% higher overall mortality rate. They had more cases of acute kidney injury because their kidneys weren't getting enough blood flow, and they had way more episodes of dizziness and fainting. The evidence is just crystal clear. For older adults, too low is a very real danger. Okay, so how do you know if you or someone you love is at risk? Well, there's a simple 3-minute test you can do right at home.
It checks for the single biggest danger we've been talking about, that sudden drop in blood pressure when you stand up. It's called orthostatic hypotension, and testing for it, well, it could save your life. All you need is a regular home blood pressure monitor. It's super easy. First, just lie down flat and relax for about 5 minutes. No distractions. Then, while you're still lying down, take your blood pressure and jot down the numbers. Okay, next step, stand up. And immediately, don't wait around, take your blood pressure again while you're standing and write those numbers down. The final step is just to compare the two readings.
So here is exactly what you're looking for. This is the big red flag. If your top number, the systolic, dropped by more than 20 points, or if your bottom number, the diastolic, dropped by more than 10 points, you have orthostatic hypotension. Even if your blood pressure looks perfect when you're sitting down, a drop this big is a major risk factor for falls. And it means you need to call your doctor right away to talk about it.
So all this new evidence is pointing us to a completely new framework. We need smarter, age-specific targets. This one-size-fits-all approach is just outdated, and frankly, it's dangerous. So let's look at what the research now shows are much safer goals. This chart is really your key takeaway. For healthy adults between 65 and 74, a systolic range of 130 to 140 is great. From 75 to 84, that target actually shifts up a bit to 135 to 145. And for those over 85 or anyone who's frail, the safest range might be even higher, maybe 140 to 150. And notice that bottom number, the diastolic, should almost always stay above 65 to make sure the heart muscle itself gets enough blood.
So here's your plan. Here's what you can do today. First, get a home blood pressure monitor if you don't have one. Second, do that 3-minute test we talked about. Third, keep a log, not just of the numbers, but of any symptoms like feeling dizzy or lightheaded. Then schedule an appointment specifically to discuss your personal blood pressure target with your doctor. Bring your log, and don't ever be afraid to speak up about how you're feeling. Ultimately, it all comes down to this really powerful idea. Good medicine is about treating the individual patient sitting in front of you, their symptoms, their lifestyle, their unique risks, not just a number on a computer screen. Your blood pressure target should be what's right for you. And now you have the knowledge you need to be an active part of that conversation.
And of course, please remember, this is all for educational purposes. Never ever change or stop taking your medications without talking to your doctor first. Use this information to start an informed conversation so you can work together to find the absolute safest and best treatment plan for you.